Lateral sinus thrombosis. LST occurs when infection causes thrombophlebitis of small venules surrounding the outer dural wall of the sigmoid sinus, erosion of the bone overlying the sigmoid sinus such as with cholesteatoma, or infection that spreads to sigmoid sinus through a dehiscence in the overlying bone. 9 It usually develops as a complication of chronic otitis media caused by the direct dissemination of the infection through the neighboring eroded bone. It is also reported in patient with an intact sigmoid plate indicating propagation by the thrombophlebitic spread through small emissary vein. Bony plate erosion by cholesteatoma, granulation tissue or coalescence initially causes parisinous abscess. Due to pressure of the parisinous abscess over the sinus wall, there will be pressure necrosis of the sinus wall and the intima, causing the adherence of fibrin, blood cells and platelets, resulting in the formation of mural thrombus. This mural thrombus gets infected and progresses to obliterating thrombus. Fresh thrombus is formed and may cause propagation proximally to the internal jugular vein, distally to other dural sinuses and through the mastoid emissary vein to the subcutis. Thrombus formation helps to localize the infection and it may be considered as a protective mechanism. Therapy of LST consists of administration of antibiotics and surgery. 18 Broad-spectrum intravenous antibiotics and removal of the infection source is the mainstay of therapy. In selected cases of LST, medical therapy alone with intravenous antibiotics may be successful. However, medical management requires prolonged administration of antibiotics. Conservative treatment of LST consisting of myringotomy, surgical incision on the tympanic membrane and pus drainage, and intravenous antibiotics without surgery is appropriate in highly selected cases secondary to acute otitis media in which prompt response to this treatment is seen. Mastoidectomy with incision of the lateral sinus, removal of the clot and local packing are considered standard care. Removal of all parisinous infection is mandatory for effective treatment. 4 Free bleeding from both ends of the incised sinus is desirable. If there is no bleeding, evacuation of as much as clot as possible will suffice. 7 31 Before the introduction of antibiotics it was felt desirable to obtain free bleeding from each ends of the incised sinus, but now it is thought be unnecessary to follow the clot centrally to obtain free bleeding nor it is thought be necessary to remove organized thrombus.